Welcome to the Real Integrative Medicine podcast. I'm Dr. Jordan Robertson, and I'm here to bring you the tools, insights, and strategies to take your health to the next level while using evidence-based integrative medicine. What's real? This is what we want to explore together. Research is ever-changing and not easy to interpret. We're bringing you the best that integrative medicine has to offer while sticking to the facts. Our mission is to elevate the practice of integrative medicine for clinicians and patients alike. Preventative solutions, nutrition, exercise, and sometimes supplements have a seat at the table in medicine, but only if we uncover real science-backed solutions. It's time to uncover what works and challenge what doesn't. Let's unlock your full health potential with an integrated approach. Ready to learn what's real? Let's dive in. Welcome to another episode of the Real Integrative Medicine podcast. We are joined today by not a first-time guest. I don't even think you're a second-time guest. I think you're actually a third-time guest, Kim. My good friend, Dr. Kim Bretz, who has really helped reshape the way I feel about gut-based medicine and gastroenterology because of her relentless pursuit of what is real in digestive health. We're on a very similar path.
That is the thing. Yeah.
This is the thing.
Yeah.
Thank you so much for being here, Kim.
You're welcome. I am crazy about this as a topic. I realize that my unbelievable pursuit to find what is going on here seems kind of crazy to some people in my life, I think. But it's such a passion, and I love being able to talk about it at any point.
And I will say that, to me, when I witness conversations online or even in practitioners, when we talk about gut health, it's maybe this lagging area of health and wellness where there is still more myth than good, in my opinion, that percolates even within medical communities. So when we've had opportunities to work together in the past where we can change the way clinicians feel about gut health, or we can change the way the patients feel about gut health, I've always been all in working with you because of this relentless pursuit. Let's start by sort of talking a little bit about where your biggest pain point is right now with respect to myths in gut health. I want to just dive right in and understand where the misinformation still lies right now.
And quite honestly, it's a ginormous list, but I think, as you alluded to, we are very stuck in the past about what we understand about what health is in GI or gastroenterology sort of stuff. And I think I was listening to a podcast, I think it was a year or two ago, and a gastroenterologist was talking about where things are going wrong. And I had that moment of, I think I get it right now. And so she was talking about how gastroenterologists are trained, and they're hospital-based. They are going to see the people who have an inflammatory bowel flare where you're having 15 to 18 bloody bowel movements a day. They're going to get the people who need an emergency surgery. We're looking at colorectal cancer. They're seeing the worst case scenarios. And then we have all of our patients who have what we used to call our functional GI disorders. We now term them disorders of gut-brain interaction. But this is our irritable bowel syndrome, our functional dyspepsia, where we've got our upper GI pain, heartburn, chronic constipation, we've got a whole bunch of these different conditions. And that's where the majority of patients lie. So when we think about these, who has inflammatory bowel disease, we think about maybe 0.5% of Canadians might have that. Celiac disease, 1% to 2%. Looking at the disorders of gut-brain interaction, a great study was done in 2023, and we recognized that across the world, they looked at 33 different countries, and we saw about 42% of the population met the criteria for at least one of those conditions. If we drill it down to Canadian women, 47.6%, or almost 1 in 2 women, would meet the criteria for these disorders of gut-brain interaction. But those aren't the things that show up in hospitals, and that's not what gastroenterologists see. So when training happens, that's not what's talked about. And so what we ended up seeing was this idea that you have this serious catastrophic condition, and we know what to do with it, or you have this functional disorder where we can't find anything wrong with you. And we know that's not actually true. We know in research studies we are finding things that are wrong, but in the standard, your colonoscopy, your x-ray, your H. pylori breath test, we're not finding anything wrong with you there. So then we would just say, hey, take dairy out of your diet, get less stressed. And when you go back and say, hey, that didn't work for me, then they're like, well, we can't find anything wrong with you, so good luck to you. And so people look because people feel horrible. It is affecting every part of many people's lives that are experiencing this, and they're like, that's not good enough. So now we start going down rabbit holes, and that whole thing has spiraled people into a misunderstanding of what gut-brain connection means, associations with food, what's happening with the microbiota, the whack-a-mole game of supplements. It's just this whole crazy, everything is, in some ways, can be misinformation because we got it wrong in the first place in how we actually train healthcare providers, in my opinion.
That is such a great story. It's almost like reminiscent of like many gynecologists deliver babies, yes, and this is where we focus in gynecology. And then when someone comes in with a gynecological condition that is not about having a baby, then we are ill-equipped to support that in that system. Yes. And I think that that's created this, some of the challenges we have even in menopause care right now is that we didn't have very many gynecologists that were focusing on menopause care, and yet it technically fell in that subspecialty. It's such a great example. I'm so glad you brought that up.
Yeah, it is. It's something that's affecting people every day because the information, we actually have so much more information on how to help so many people. It was funny because I was taping a podcast with an MD last week and we were talking about this area, and he had said, like, I feel like I failed a lot of my patients because I don't know about most of this. It was like there's just this huge disconnect. And I think we can say that within MDs and for the gastroenterologists, like they have so many patients to deal with who are dealing with the catastrophes that, of course, they're not hand-holding and talking about diet necessarily, but I see the problems within our own professions as well and within integrative medicine where historically we've just said, we'll do an elimination diet, we'll just throw some supplements at you randomly because we saw a tissue study that showed this. And then the thing we see is that people may feel a bit better or they may feel better for a period of time, but a lot of people loop with their symptoms and they're just, okay, it's back again, or it was diarrhea and now it's constipation and now I have stomach pain and now the bloating's there all the time. And so we're getting people who are stuck when we do have a lot more information on what we're looking at now and how do we understand this gut-brain connection, which is so beyond just saying, get less stressed, be less anxious, it's in your head, sort of this crazy scenario that we understand more, but it's hard to get the information out when it's not something that people are dying from a lot of the time.
Yeah, and that I think that's where the quality of life and the health related quality of life is a metric that we care about, right? And in our position, when we look at even the way we deliver public health, it's such a low priority in public health because public health is really about how do we keep the most number of people alive today? Mm-hmm. And can we make widespread rules that maybe decrease major death and disease tomorrow, right? That's really what public health is about. Yep. And it's not built for the uniqueness that's required for digestive medicine. And so that's, if you've heard in the past, these sort of broad brushstrokes, diet doesn't matter, or this doesn't matter, or this doesn't matter. It's because if we looked at the entire population, maybe, or no one's dying from having a little bit of bloating. So it can't be a focus of public health, but then it leaves people feeling undersupported, and undersupported people are resourceful and they watch YouTube.
They do. And this is the whole area within misinformation is we know that there's a vacuum right now. We know that there's less trust within institutions and the places that we've historically gotten information from. And so if we're not getting timely information from healthcare providers who are going to have the access to be able to talk about things in a really strong, evidence-focused, empathetic, and easy to understand way, we're going to go to any place to get information right now. And we're seeing, even in the recent Canadian Medical Association survey for Canadians that just came out, we're seeing that this is causing people a lot of stress and anxiety, but they actually can't get good information. And so when we're talking about GI, where this is an area where good information hasn't been provided in the first place to the healthcare providers, it's an even bigger vacuum. And most of the things within treatment, within gut health, and this is not including things like inflammatory bowel disease, where we talk a lot about medications. In most cases, the treatments are not medications. So people can go and do things on their own. And I think it empowers the idea of, well, if I took out dairy and it made me feel a little bit better for a while, then maybe I should take out the next food and the next food and the next food and the next food, because it is something that you can control and you can do. Because as you said, that quality of life piece, when I think about why I became a naturopath, I am so pro healthcare in the sense that I love that we have things that keep us alive. We have treatments, therapies. I want to have the people in healthcare who do that sort of thing. But that difference between living a long life and dying a long life, I think, is huge. And so for me, when I'm looking at my patients with bowel disorders and bloating that they're feeling all day long, they're feeling after meals, they're worried about getting questions about, am I pregnant or not? You don't know if you can go to the soccer field to watch your kid's game because there's not a bathroom there. When we look at health-related quality of life with a condition like IBS, it's as bad or worse as people who have the catastrophic with IBD. It's on par with people who have congestive heart failure. We know that from the research. These people are suffering on a day-to-day basis, and often it's being treated like a mosquito bite in a lot of cases. Like, just, it's fine, and it's not fine. It is everything that people are experiencing.
Do you know what I was dying for when I was a practicing clinician? I wanted someone to summarize the latest research, tie it up with a nice little bow, and deliver it to my inbox every single month. I'm Dr. Jordan Robertson. I'm the host of the Real Integrative Medicine podcast, and this episode is brought to you by my free integrative medicine magazine called The Stacks. We're all dying for unbiased, unindustry-funded information to help us be the best in practice. The Stacks delivers you quality articles every single month on the latest research on things you care about in practice, as well as opinion articles and business advice for integrative practitioners and naturopathic doctors. You can subscribe to the Stacks with the link in the show notes today and get access immediately to all of our back issues that show you exactly how to be an evidence-based practitioner. I hope you sign up and you'll enjoy it.
Yeah, I've definitely seen a shift in, I'm always curious about studies that look at like where patients get their information from. I always find that so fascinating. And the number of like chronic conditions where people are trying to self-treat through dietary change has exploded in the 15 years that I've been in practice, where, you know, I think back in the day, I may have suggested to a patient, like, maybe we can make some adjustments to their diet. And they'd be like, what, really? Like, you think food makes a difference? And now it's like, oh, 80% of people who have endometriosis have tried to change their diet to see if it helps their pain. Like, people are using nutrition as a tool. And kind of like, I always loved your term whack-a-mole, because it's, I don't know, maybe it's because we're old and we remember what that game actually is. But this idea, it's the one where like the little groundhogs or whatever put their head up and then you try and like smack them with the, right? It's like a carnival game.
Exactly.
And I think when people do make dietary changes, they do temporarily often feel better, but not always for the reason we think. And sometimes we even just feel better because we feel in control, which is a crazy experience, but that is true, that can happen when patients feel better just because they did a thing, not because the thing itself actually worked. And it can create this whole cycle of misunderstanding your gut condition and then misunderstanding why things are working. And I think even us as healthcare providers were a little bit at risk of doing that too.
And I'm going to say it's probably way more than a little bit, and especially when it comes to food. And I'm obviously biased that I think gut plays a huge part in this. But I always think about when we take away food from people who have gut conditions and we say, oh, my stomach doesn't hurt as much, or I don't feel as full, or I don't have as much bloating, I don't have, my abdomen's not puffing out in the same way. We have this idea that that means that the food was the problem. And we've talked about that as healthcare providers for a long time because we didn't have proof that that wasn't true in some ways. From the upper levels of gastroenterology, of course, they were like, food doesn't play a part at all, probably until about 10 years ago. But patients would be like, yeah, I take away the food and it made me feel better, and bringing it back makes me feel worse. But we're seeing, and this is one of the things within the gut-brain connection that we think about a lot, is that it goes so far beyond this idea of anxiety and stress. So we know that anxiety and stress for some individuals will worsen their symptoms. It doesn't mean it's completely transactional, though. It doesn't mean that every time you're stressed, your gut is going to be worse, and every time you're calm, you will never have a gut symptom. So it's not quite like that. But it goes so far beyond that. So we see that we're actually getting this hyper responsiveness in the nerves in the gut. So I am someone who talked for a very long time about the idea that if you're experiencing too much gas or bloating or your abdomen's distending, it means that you're producing more gas than everyone else. You have too many bacteria, you have types of bacteria that are producing more. And this was a common thing that was talked about in medical communities. It has biological plausibility, like we're like, that makes sense. And then we started looking at, so if you're experiencing bloating and distension right now, how much gas are you producing compared to the average person? And we found that in 75% of people who had acute bloating and distension, so it's happening right now while we're testing you, they're not making more gas. They don't have abnormal pockets of gas, but they're feeling any gas that's being produced. So the pain centers in the brain are lighting up. And so for a lot of people, when we're talking about disorders of gut-brain interaction and this miswiring or miscommunication between the gut and the brain, we are seeing that it's the nerves in the gut are actually misresponding, and they're feeling all the feels. We're feeling digestion happening when people are eating. So when we think about a low FODMAP diet, and that's a diet where we take away foods from people who typically have IBS, and that's kind of been our standard of care, we're now looking at the fact that people who don't have gut issues versus people who have irritable bowel syndrome, and we feed them the same food, they're basically making the same amount of gas. It's just that the people with IBS are feeling the gas. So the food's not necessarily the problem. So a short-term elimination for people where it's safe, that can be helpful in feeling a little bit better, but it's actually not the solution. And the more we do that and the longer we do it, and the more we're like, oh, I'm now going to take out this food and now I'm going to take out that food, we're just trying to solve the problem by taking away the sensation, not by actually helping with why the nerves are hyper responding. And so I think about that with me wearing glasses right now, that if I was going through this interview thinking, I'm wearing glasses, 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 that's crazy making. That is what is happening to people who have these disorders of gut-brain interaction. They're feeling digestion, they're feeling the food in their stomach, and they get full really easily in some cases, or they feel the bloating, or their bowels speed up or slow down because the nerves are not responding properly. And so that's where we're starting to look more now at how do we deal with that, which is a fascinating area, but it means that we have to rethink some of the things that we held true. And if that's hard for us as healthcare providers to do, of course it's hard for everyone to do at that point.
Totally, because I think we like to, not blame something
Yes.
necessarily, but
I would like to blame something.
It feels easier to be like, that apple destroyed me, right? Rather than feeling like it's something. And I think because maybe we don't understand, well, you're going to talk about solutions. And so if you're listening to this and you're like, no, I want to blame the apple. It can't be my fault, right? It can't be my gut's fault. Like there are solutions that we're going to talk through here. But I think that, when I started to explain it, I was never that great at treating digestion in practice, which is partly why when I met you, I latched on to you like a bad rash, just being like, please teach me how to do this. And because I also and now when I look back on it, if I was successful at helping someone with their digestion, I just had got lucky, right? Like I had got lucky / the other things I was doing to support them with their sleep, with their mood, had a positive impact on their digestion. Not because I had the tools and skills to be good at it in that moment. I just had got lucky in terms of helping them, because I had also taken the approach of like, well, let's remove some of these foods and let's, focus on fiber and probiotics. And I hope that worked. Like that was literally like I'd cross my fingers, and if they came back, I felt really stuck. Like I didn't have the tools to help them. And now we know so differently about it. But I remember when I started to explain to patients that like, you have the same amount of gas. That was such a difficult concept for them to understand. They'd be like, oh no, you don't understand.
Right.
No, you don't understand. The same. It's the same. It's the same amount of gas.
Yeah. But it's something interesting, because I will say, talking about this in conferences with healthcare providers, and I say that, and with most conferences, the questions happen at the end of the presentation because it's being taped and it's this whole thing. And you're watching the audience, and I can just see the hands creeping up in the middle of the presentation, because I know that there's going to be fighting against me on this factual statement.
They're going to say, you don't understand, Cam.
Right. But then I'm going to get the argument that is, but I can see it. Like I can see my abdomen distending. I can see it puffing out like a balloon, and it looks like I'm 7 months pregnant. I know I'm producing more gas because I can see it. And this is something that we're also seeing, that having these GI conditions is really stressful. And if we I think about me all the time with this, that if I'm really stressed, I get a lot of tension in my neck and shoulders, which I'm pretty sure I keep my massage therapist in business. But it's something that our diaphragm, that muscle that sits between our lungs and our internal organs, it can get stressed as well. So normally when we eat, our diaphragm relaxes, and it's supposed to kind of float up towards your chin, and that's going to make more space in the abdomen. And at the very same time, if everything's working properly, your abdominal wall muscle should pull in towards your spine. And when it does that, we have that we keep a flatter stomach when that occurs. We're putting in food, we're putting in liquid, our bacteria are fermenting, they're making gas, but that gives that space and capacity for all of that to be happening. But what we see for a lot of people who experience bloating and distension is that their diaphragm contracts when you start chewing. So instead of making more space, we're now shoving down onto our internal organs. And so the abdominal wall muscles can't hold that anymore. And now the entire contents shift down and outwards. And so a lot of the time when we're saying, I see my bloating, I see the gas as distension, it's puffing out, and we're assuming that's extra gas, it's actually our internal contents that are just shifting forward. And this is something, when we're looking again at that gut-brain connection, we're seeing that the stress of the conditions themselves can cause our muscles to physiologically change. And so we can work on those things. Those are things that are absolutely changeable. But that's the thing, is that even within healthcare providers, we're like, but no, that's not my patients. I'm like, it can't be that 100% of your patients have that happening. It can't be. And again, I'll get the question that comes up, like, what about my patient who feels like they're bloating with water? And I'll ask the question, like, what is the condition that you think water can be turned into a gas through fermentation? Like, that's not actually physically possible for that to happen. So this is something where that's actually a really good clue to me if people are like, it started out with lactose in dairy and then the FODMAPs, and then I started taking out this, and now I'm feeling the bloating all day, and it feels like anything can bother me, but sometimes it doesn't, and water can do it. That's actually a really good clue for us to say, this is probably a nerve response, at least in part, to what's going on. And that we want to start thinking about that gut-brain connection. And again, we want the villain, we want the answers. And so we can start to look at what some of the answers are. But I think one of the other things that we do as healthcare providers, and I think as patients and just human beings, is we want the one thing. And so for a lot of us, it's not going to be the one thing. We can see there, it was the nerves are hyper-responding. We can see that that can start simply from having traveler's diarrhea when you went down south on holidays, or a food poisoning, or you had appendicitis. That's a really easy way for the nerves to turn on after the microorganisms get really mixed up. We see that happening easily, but now we're thinking about it that we've got a bit of upset in our gut microorganisms. We've got a hyper-responsiveness of the nerves, and then that caused our diaphragm to not be working as well as it should be in the way that it normally would. And so we're thinking about this from what are the things for you as an individual that are a problem, not just that you've been diagnosed with irritable bowel syndrome. And the way that we look at it in social media often is, it's gluten, it's the FODMAPs, it's histamine. Like we want to have this one word answer of the thing that you will do. And by the way, buy my 5 supplements that are going to solve all the problems, and to die because your bloating is exactly the same as everyone else's. And we just know that's not true. But
you bring up a good point there about looking for like the one thing, right? Because as you're talking, right, and you know, it's funny because I think we have a hard time holding many truths at the same time. Like we believe we are complex beings, right? Like I think if I said like, no, you're really simple, right? People would like almost take offense to that, right? They'd be like, oh, no, I am a complex being. But then when we remind them that their problems require a complex solution, they're like, no, I would like it to be one thing.
Yes, please tell me the one
I would like one
supplement that I need
visit.
to take. Yes.
That's right. I would like one visit. I would like it to be one supplement, and I would like to take out one food. But then, and so that, but yet we probably like on a fundamental level realize that all of the things impact our gut. Like even the way we have talked historically about anxiety and butterflies in our stomach, or, you know, we've always talked about our gut deeply connected to our nervous system. And yet, you know, when we've tried to introduce this idea here that like, okay, this is more complicated, this requires some patience, this probably requires us to move through a series of steps with you to, you know, unravel this onion, then we like immediately feel uncomfortable about that. And you're like, but couldn't it just be this one food?
Because I'll say, like, I will get the scenario where someone went to Mexico and got traveler's diarrhea in November, and they never had gut issues before that. Now they're like, oh, this thing is happening. And I will legitimately see in that 24-year-old that we do like the one thing, and then they're like, oh, I'm just back to normal right now. I'm like, yay, congratulations to you. But that's not the scenario for most people who are coming in to see me, because usually by the time people are seeing me, they've talked to their family doctor, they have a gastroenterologist. Often they're getting referred from another naturopath who's like, this is not my thing right now. But they've had all these conversations, and they're telling me that it started when they were 24 and now they're 52. And there's been so many iterations of what's happened, and I'm very clear that we're going to be walking through steps. So we need to figure out what is happening for you individually. And here's sort of the base outline of what does this look like. And I think it is important that we calm down people's symptoms. And that for me can happen in a multitude of ways, whether that does include some dietary changes, whether we're looking at some relaxation techniques. Sometimes it is going to be a medication, because it's really hard to do some of the bigger things of more comprehensive changes within our life if we feel like shit all the time. If we're not sleeping, if we're stressed, if we're afraid of every food, if we can't figure out how to manage our bowel movements at work, like, how do you make bigger changes if you can barely function in your day? So it is something that, yeah, we're probably going to start just trying to make you feel a little bit better so that we can work on other things. But for me, I am often looking at what is going on that started this. So if it's something that a major life trauma was a trigger versus having appendicitis or taking antibiotics for long periods of time, those are going to be different things that we're approaching, but we're often are going to be thinking about what is happening. And I'm using the idea of sort of that prototypic IBS person, but we are going to be looking at the ideas within these conditions that we see that there's a miscommunication between the gut and the brain, that we see that there are changes in the transit time in the gut. There are microbiota changes that are happening. We know that there's low-level immune activation or mucosal changes, but not at the level that we would see with someone who had inflammatory bowel disease. So we have multiple things that we're looking at that we're trying to sort out for the person in front of me. But it's kind of nice because we have some bigger umbrella understandings of, okay, this is what diet is going to do. Within our bucket of microbiota, even though we talk about it all the time within the world of, well, I was going to say within social media, but within everything, within research, within the traditional news media, it's such a popular topic. We actually don't know that much. So we've got our small bucket of what we can talk about there. We have our information about gut-brain options, and those are going to include things within cognitive behavioral therapies, within disordered eating patterns, hypnotherapy, which was a thing that was so hard for me to get my brain around to even look at the studies. I think as someone who grew up through the 80s and 90s, I remember my parents' Christmas parties that they used to have at that time, where you'd have a Santa who would bring presents to the kids, and then you would have the adult entertainment, which would usually be a comedian or a hypnotist. And the hypnotist would make people like dance like a chicken on the stage. And so the studies around hypnotherapy came out, and I was like, I'm not looking at those. That is ridiculous. I cannot, as an evidence-based practitioner, talk about hypnotherapy. Like, you have got to be kidding me. And then there's more studies that were coming out and meta-analyses where we pooled data together, and they're like, it's great. And we're talking about things like it's as effective as a low FODMAP diet. And my brain was like, but there aren't as many people studied, so I'm not going to look at this yet. And then we started getting recommendations from groups like the American College of Gastroenterology, who were saying, yeah, this is first-line therapy. This is above the medications. This is what we're looking at within this. And we're seeing other stress management techniques, but very focused on gut things. So it's not just be less stressed, it's using techniques that are going to be working around the gut specifically. Same thing with the cognitive behavioral therapies, same thing with the hypnotherapy. It's very directed towards our beliefs, that miswiring, all of that sort of stuff, which is fascinating to me.
So fascinating. I remember the first time that I looked at a study on journaling for IBS, and I was like, I felt like almost silly putting it into our resources for the confident clinician, but they had the patient's journal. There were like 5 questions. It was about trying to get, and at that time, I can't imagine that at that time that those authors really understood all the ways why it was working, right? However, the questions were really about like catastrophizing. And the more we start to learn about the stress response and the impact on chronic pain, chronic symptoms, and then any hypersensitivity, whether it's like visceral hypersensitivity or hypersensitivity in like your gynecological system, there is a component where catastrophizing your pain and your symptoms actually creates this feed forward loop where it's worse. So you feel terrible, you are scared about it being terrible, and therefore it becomes even more terrible. And if we can intercept that with different thoughts or some practices, we can actually decrease your experience of your symptoms. But I remember writing it down for our clinicians, and I was like, have your patient journal. What's the worst case scenario with their IBS? And then you imagine the patient being like, I shit my pants, Jordan. Like, we want you to journal about this.
That's the thing that comes. Yeah. Yes. Yeah. And it's so challenging with it, but it is so important. And we see now, and this is what really, as we're going forward with our education for practitioners, is we are really looking at screening around catastrophizing, screening around this visceral hypersensitivity. So we have the visceral sensitivity index where we're looking at, like, what are your thoughts and feelings around eating out? If you don't have control, if you don't know where a bathroom is, we're looking at all of these things. We're looking at something called gastrointestinal symptom-specific anxiety. So we know that about 40% of patients diagnosed with IBS have anxiety. That also means that 60% don't. But when we look at the very specific things around their anxiety, around the symptoms of their gut, we see that all of a sudden it gets a lot higher. And that quality of life piece, but also that feedback loop that we have, becomes more difficult. And so there was a fascinating, and sometimes I say fascinating, and I'm not sure that everyone else finds it fascinating, but really, I think this is a fascinating study that came out that looked at people who self-selected as being gluten intolerant. And so there are very important reasons that people would not be able to have gluten in their diet, and celiac disease is obviously the number one that we think about. But a lot of people are just saying, I'm not tolerant to gluten. And so what they did was they looked at 4 different groups. So of these people who are all gluten insensitive by their own self-reporting, they were all put into either two groups that were told that they were going to be eating gluten. Half of them got gluten, half of them did not get gluten. And then another group where they were told that they would be getting gluten, half got it, half didn't. So these different things. And we found that if you were told you were going to be eating gluten, whether you ate it or not, people responded very badly in those scenarios. And so it's a really good example of how if we believe something is going to be a problem, in some cases it will be a problem whether you had that thing or not. So I found that part fascinating. And that was done in London, in the UK. But a McMaster group did something that was very similar, but then they actually checked in on their patients 6 months later after they had been told what the results were. So you were told you were going to eat gluten, you didn't eat gluten, but you still said you felt bad. Or you were told that you were going to be eating gluten, but you didn't, and you told us that you felt bad. So where that misconnection happened, they went back to say, so are you eating gluten now? And most people weren't. They just were not comfortable with going back because that fear can be so high. So even in the face of proof, a lot of times people are not going to change their mind. And that's where we need to really start looking at pulling this together with another human being or programming that's going to reinforce these different pathways. When we're often just been told a fact, I guess, that doesn't necessarily resonate just as a single piece of information. And so that journaling side of things, I can see that we can start to form different pathways and associations the same way that we would in doing any cognitive behavioral exercise or hypnotherapy or any of these sorts of things. I think it's really interesting with that.
It's so fascinating. I find that stuff so fascinating when we we fib to the patient in the study, which is ethical under the cert. Like the people know that they're doing a thing.
Yes,
right?
they know this is going to be happening.
They knew it was happening. We didn't recruit unknowing people, lie to them, right? Even though it feels like we were lying to them. But then when we even expose the truth, they're like, oh, but that probably couldn't have happened. Like they, and I imagine like, and even if you think about like how we would react, right? If you felt something so deeply in your soul and then you get told, well, that's not actually what happened, how difficult it would be to unravel that for yourself, right? And like, if we were so simple as to be like, flick the light switch, okay, cool, like got it, believe it, I'm fine. I mean, most of healthcare would be out of a job at this point. We wouldn't need knowledge isn't enough, right? Like facts aren't enough, actually. Which kind of brings me to this next point is I would love for you to talk a little bit about your course, because you've done so much great education for our clinicians at Confident Clinician. Almost 100% of our gut-based stuff has been done by you, or not quite as well by me. Mostly done by you or teams that are led by you. Yeah, but now you've got something now you've got something for patients and for the public to help them actually be able to move the needle on this discussion. I would love for you to be able to tell us a little bit about that.
Yeah, absolutely. So it's funny because when I thought about even naming a program for the public, because I talked to people about it, and I got a lot of people like gut intuition. And it's something that even with this discussion, I was like, I can't name it anything about gut intuition at all, because we're often wrong, because we're getting this missignaling and miscommunication. So I was like, I can't do it. So what we actually looked at was gut check. We wanted to have this essential guide to digestive wellness. So one of my biggest pet peeves in the world is how much misinformation there is, and also how little time there is in the healthcare system. So people go into appointments to try and get information, to try and get help. And a lot of the time, they're not getting anywhere. And then we're going out into the world to just try and solve this problem ourselves. And often we're just digging ourselves into deeper holes with this. So I really wanted to put together a program that was going to look at all of these different facets. So what do we actually understand about gut health right now? Where are you probably going to fall on this continuum of disorders of gut-brain interaction, these physical changes that are happening? How do we understand testing? When do you have to ask the questions around, is this something more serious and we need to check for these things, versus I've had all of this done, we need to start looking at other things because it's not helping me to stay in this world of catastrophizing. And then we start to look at what are a lot of the myths. We talk a lot about food and what we understand and what we don't understand, why fiber is so horrible to talk about, the microbiota. I love to compare the microbiota to the story of the Lorax, so getting some context around how can we think about this in fun ways, how can we support our microorganisms within what we understand right now. So we've got some tools to help you really understand how much you're doing to help or hinder what's going on that way. We go through a primer on supplements, the good, the bad, the ugly, because there's so much stuff that just doesn't have the information that we want or need, and a lot of people are putting so much effort and money into doing things, and I'll get people coming in and they're like, this is for my gut healing. I'm like, okay, you've been doing this for 9 months right now and you feel no different, and actually the evidence is really horrible on this. So I'd love it if people knew up front, like, where do we have good information? And what are some of the other things that we just don't really know about? And how do we actually have great appointments with our healthcare providers? Whether that's your family doctor, whether it's a gastroenterologist, whether it's a naturopath or another integrative provider, what information do you want to walk in with? How do you want to approach this within the questions you might want to ask, or make sure that you're actually getting the things talked about that you need to talk about? And how do we bring it together with other healthcare providers as well to get best care within this? So I tried to make it really sort of this big comprehensive look at really where is it going wrong and how can you move forward without getting stuck into the loops of bad information and spending so much money and so much time being stuck within this. Because I think I see so much that makes me sad when people might get a little bit of traction on their symptoms. So we go from 100% to 75%. You're feeling that 25% better, but now you can't eat with your family. You can't go on vacation and survive with the food that's going to be there. You're taking supplements 5 times a day. You're still terrified about everything. And to me, that's not health at all. It's something that I'm really striving for people to understand. How do they get the balance? What is okay, what's not okay within symptoms, and really find this good, I keep saying the word balance, I feel, but really this balance on health where you get to live and not be experiencing symptoms all the time.
Yeah, and I think for patients who've had chronic digestive issues, that probably sounds like a miracle, right? To have both of those things at the same time.
Right, yeah.
But I am excited about this program because I think that, you know, there is a knowledge component that is still missing in this area of medicine, right? It's not like everyone knows what to do, they're just not doing it. They don't know what to do and they're not doing it. So there is a component. If you are struggling with digestive symptoms every day, there is information you're missing, not just coaching. I mean, there's some areas of health where like people know, but they need help doing. This is one of those examples where the knowing is actually still missing, and education and support to walk through those steps on your own will make such a tremendous difference to how you feel. And given that this is something that shows up in your life like 3 to 9 times a day if you're me and you graze, that you can't help but need the support, because it can make such a huge difference to how you feel every single day.
And I think when we look at that food component, what we've offered for the longest time is take away food, kill the bad bacteria, whether it's with herbs, whether it's with antibiotics. Yet on the other hand, we're saying, oh, the good bacteria matter a lot, yet all we're doing is starving and killing in those scenarios. Like, we've actually had it wrong for so long, and we wonder why our patients are getting stuck in these loops of they feel that they're okay if they restrict almost everything and they're on an antibiotic like rifaximin or herbal kill-offs, and the second they stop, they feel worse again. And they're still just creeping down that feeling bad. And so, yeah, like just basic concepts around what is important for health isn't what we've talked about for so long. And yeah, I look at things like my patients know that, yeah, eating fast food, ultra processed food all the time is not good. Most people aren't coming in saying, hey, I ate at McDonald's 6 times yesterday, and why do you think I feel so bad? They're saying, I'm eating the best that I can already. I'm trying to do all these things. And that's where that component, and many components are often missing within this, that there are things we can actually be doing to feel better.
Yeah, we're going to share Kim's course because I'm a huge fan of this course. I've seen all of the content of it, and so I guess my 100% stamp of approval on using this tool to support yourself. So we'll put the links to the course right in the show notes. How else can people get connected with you, Kim? Like, where can people find you?
Yeah, so probably the easiest is my website or Instagram. Both of them are Dr. Kim Bretz ND, either .com or through Instagram. Webpage, definitely for people who are looking to book. This is also where practitioners can find resources to help them in practice, things along those lines, and also access the public-facing course as well. Instagram, definitely I share my frustration with things that drive me crazy in healthcare. You may also hear about my journeys with trying to figure out whether I am a ballerina or not. Those are the sorts of things that tend to come up there, but also the links to all of my stuff as well.
I was going to say, you can find rants about GI health, you can find rants about ballet, you can find rants about on Kim's Instagram.
Yeah,
which
share.
You are one of Sean's favorite Instagram posters. Like, he is often like, did you see what Kim posted? And I'm like, yes, I saw what Kim posted. So we'll put the link to that in the show notes too, because that's a highly recommend from the Robertson household. Thank you so much, Kim, for doing this episode together. You are our go-to person around GI health and wellness and misinformation. And now I would love that we have a place that we can direct people to go to have even more information that done with you kind of approach to learning and doing so that you can really actually make change in your health. Thank you so much for being here today.
Absolutely. It was so fun chatting with you. I really look forward to seeing people more out on this podcast and everything that you're doing.
That's it for today's episode of the Real Integrative Medicine podcast. I hope you're feeling inspired, informed, and ready to make changes that truly support your health. If you found value in today's discussion, don't forget to hit subscribe, share this episode with someone who needs it, and leave a review. It helps us reach even more listeners just like you. Your health journey is personal and it's powerful. Let's keep building on the knowledge to give you the confidence you need to thrive. It's important to remember that the Real Integrative Medicine podcast is for educational purposes only. Be sure to talk to your doctor before making any personal health changes. This podcast isn't intended to diagnose you, and no doctor-patient relationship was formed by listening. We'll see you next week.